Hey, I'm Dr. Woods at TexStar Chiropractic. Today I wanted to go over with you a condition that we see here in the office. It's less common than our traditional neck and back pain, but it is something that we see pretty regularly. And that condition is called carpal tunnel syndrome. Many of you have probably heard this term. And usually this is where the patient is going to present with a lot of pain into their hand, specifically into the thumb, the index finger, the middle finger, and sometimes the inside of the ring finger here. And usually the most common symptom is going to be numbness, tingling associated with some type of pain or discomfort. And it's usually going to be due to some type of repetitive motion, or a lot of people will wake up in the middle of the night with their hand numb because they're sleeping in like the fetal position. And so usually what triggers this is there's a nerve called the median nerve that comes out of the neck and comes down into the arm and forearm, and then comes through this notch in your wrist and branches off into those fingers. And you can kind of see in the image here, this is that median nerve, and it has those branches that go into those areas. But most commonly, what the reason why you have pain and discomfort there is due to some type of compression that's building up in the wrist. And usually it's due to one of the wrist bones called the lunate. The lunate is one of the 9 bones that make up the wrist, and it's the most common one that becomes mobile and can create that compressive force on that nerve. Now, in a traditional medical setting, what they'll do to relieve pressure on that nerve is to kind of cut this, what's called the transverse carpal ligament, which holds that nerve in place and builds a bridge onto the wrist. But from a conservative approach, which is what our main mode is to alleviate that pressure by doing some mobilization or manipulation of the wrist to alleviate that pressure, and then calm some of those symptoms down with the cold laser therapy that we have here in the office. That's going to really bring down a lot of the inflammation and swelling, and a lot of times the patients will start to feel a lot better relatively quickly. Some things you can also do at home for this, or if you're one of those ones that tends to sleep in a kind of the fetal position with your wrist nice and flexed, is to get a wrist splint that's going to keep your wrist in a nice neutral position, which is going to allow there to not be as much compressive forces on that area as you're sleeping, which can be a big trigger for a lot of people. The other thing you can do is to make sure that once things calm down is to build up some strength and stability in the wrist by doing some resistance band exercises, usually like a thicker rubber band, and doing some of these motions will help build up some strength into the forearm, which is going to stabilize the wrist. All the muscles of the forearm come down into the wrist, into the hand. And so by building up a nice stable base into the forearm, it's going to make sure that your wrist is nice, sturdy, and stable. Thanks for following us. And if you like this video, please like and subscribe to our channel. Thanks. Have a great day.